Hi, this is a quick overview and a study plan for your end of trimester exam. So remembering to look over each modules, and in module 2 we looked at some key areas, first starting at contraception, then we worked through prenatal assessment, looking at nutrition, urinalysis, weight and risk factors for this woman and her support measures. Then we looked at pregnancy assessment. We looked at risk factors, progression, feeding, labour choice. We also looked at the support and mental health of the woman and her family members. We talked about what assessment tools that may be useful and also how you might sort of look at each trimester and the different risk factors within that. We also then looked at postnatal assessment, mental health, neonatal assessment in that early first period, including reflexes. We looked at types of feeding, particularly with breastfeeding and the support that is needed with that. And we had a quick overview of the milestones in that early time. Another aspect that we looked at was intimate partner violence and nurses' role in reporting and supporting the woman through that. So particularly the assessment tools that we looked at, the contraception, the intimate partner violence questions, the reflexes, and also the APGAR scores. So remember to just refresh your memory about those particular items. In module 3, we looked at normal development of a child from the neonatal period through to the adolescence. We looked at milestones and how to measure and look at those milestones. We also looked at paediatric assessment, both of the non-acute and the acute child. We talked about waiting and doing that observation aspect first before we actually went in and touched the child. We talked about including the parents and using the parents as excellent support. And in relation to that, we talked about Ryan's rule and mandatory reporting. So particularly we looked at paediatric assessments of the different scales that we can use and also how we might measure and ask the questions about depression in that early stage. We looked at the different scales and charts for height and weight of children and also the milestones. In module 4 we looked at adolescence. We looked at their key development stages, which included physical, cognitive changes, and we also looked at the psychosocial development. In relation to this, there was a big aspect of the module which looked at mental health and mental health assessment, which led then to risky behaviours and sort of discussions and what the nurse's role is in relation to that, drugs, alcohol and sexual risk factors. And we also looked at hospital admissions for children and adolescents and the risk factors and the most likely types of admissions these children and adolescents have and what your role in assessment is. And there was 2 main assessments that we looked at, and this related to where the child was and also their mental health assessment. And we talked about the importance of being respectful, confidentiality, looking at the child's age of consent and where they're emotionally able to consent. So in summary, it's important that you do read over the modules, look at the recordings of the tutorials and also the little mini lectures that we've got. The exam is all multiple choice, so remember, read the questions well and decide what is being asked and then choose the most correct answer. Thank you.